Good afternoon. I'm Roseanne Haggerty. I'm the founder of Common Ground and with my colleagues of Community Solutions, a new not-for-profit that we are creating and launching this summer to take the work of Common Ground to scale. And I'm joined today by my colleagues Andrew Haupt and Catherine Craig. Andrew is in charge of housing development and Catherine of our health integration work. There are about 2 million people who experience homelessness every year in this country. 600,040 is the average number of homeless individuals and members of families at any given day. And 20% of those are veterans. So today there are about 120,000 homeless veterans in our cities. It doesn't have to be that way. 20 years ago, we started Common Ground around the idea that a new type of housing, supportive housing, that combines affordable housing matched to health, mental health, and employment services is a cost-effective, sustainable, and permanent way to bring people out of homelessness and help them return to productive and satisfying lives in their communities. Our first project was the restoration of the Times Square Hotel in Manhattan's Times Square on the corner of 43rd and 8th. And I ended up starting Common Ground really in response to this building. I lived next door to it as a volunteer, living in a tenement building as a volunteer for a shelter for homeless young people. The Times Square Hotel was bankrupt and really a symbol of all of the social problems that collected in Times Square through the 70s and 80s and early 90s. The work of transforming that building created homes for 652 individuals, half of them coming from homelessness and half low-income working people working in the hospitality and arts and related fields. So a response that added value to the community as well as transforming the lives of those who live there. However, as important and clearly valuable as that work was, we looked around after creating the Times Square Hotel and saw that the same homeless people that we had seen in Times Square before we started the project, many were still there. We realized we hadn't figured something out, and so the rest of our work in those and the subsequent 20 years has really been figuring out what is a scalable and enduring way to not just create sustainable and beneficial services for the homeless, but really to tackle the issue at its root cause. And what we learned we needed to do was to take this on one person at a time in a targeted, geographically focused way. In places like Santa Monica, where Helmut here had been living in the community for 40 years, was priced out of his apartment and ended up living on a bench for over a year. Or in Phoenix, where Donna similarly lost her home. 12 months on the street later, she's moved back in. Or here in New York, Laura was homeless for 7 years until our staff found her living on the street and worked her patiently through the process of connecting her to housing and the support services she needs. There's Laura now. Or Ed, whom we met on the streets of Skid Row in Los Angeles 2.5 years ago. He'd been homeless for 30 years. That's Ed now, after moving back into housing. Basically what we learned is that you need a process to actually focus on the long-term homeless, to help communities identify who they are, connect them to the support and housing they need, and to provide the follow-up and sustainable assistance. If you do that in a targeted way, going to the places where there are the greatest numbers of the homeless and where people have been homeless the longest, that's how you begin to catalyze a tipping point strategy that can ultimately lead to very different outcomes. We are scaling up our work with a particular focus now on reaching and housing 100,000 people over a 3-year period, at least 20,000 of those to be veterans. And we're doing that not by our own direct development work, except in part, but by growing the capacity of communities throughout the country to participate in a collective impact effort. Here's the situation that exists in most communities. Ed, whom I just described to you, lived on the corner of Gladys and 5th in Skid Row for 40 years. He's now living about 4 blocks away. It took him 30 years to get there. Why is that? There is no system in place in any community that actually identifies the most vulnerable and systematically surrounds them with the assistance they need to move into affordable housing and get the help they need to stay there successfully. This is something we can do. It's something that Community Solutions is helping communities throughout the country to learn how to master on their own as part of a national effort, part of a national movement, and part of really a joyful effort to realize that we can solve these complicated problems by just actually building systems around people who can't navigate our complex bureaucracies on their own. Here's the possible path that I'm beginning to describe, and this is the campaign framework. In communities throughout the country, and there are now 85 communities participating, and in a year, we just passed the 9,000 mark of vulnerable people housed. And I should say in our first 20 years at Common Ground, of which we're very proud, we probably helped 4,500 people out of homelessness, and in just 1 year using this scaling methodology, we've passed 9,000. First, you help communities put their local team together. You need to create partnerships of housing authorities, public hospitals, the VA, of the faith community. Second, you actually go out to the street and train community volunteers to interview people one at a time and assess people on the basis of their health vulnerability using a study that we've created with the doctors who did the initial research. Third, you're simultaneously organizing your housing resources and inventorying them in a new way to actually prioritize those who are the most vulnerable. You then move people into housing based on that priority system and then link people to the resources they need to stay there. The impacts of this are enormous. These are New York City statistics provided by the Corporation for Supportive Housing, an important partner in our campaign. Supportive housing costs on average just over $15,000 a year. And in New York City, in any community, you'll see these kinds of savings. We are talking about people, because we specifically target the most vulnerable and system-involved individuals, people who otherwise are in these hospital, mental health, criminal justice institutions. So the sustainability of our model and this model that is spreading throughout the country is profound. The way we've organized our work in Community Solutions is to have this broad network of change agents that are mobilized and connected through the campaign to assist people in strategic communities with direct development of new housing, and to a broader group, consult with them on how they redesign their housing systems. We choose our communities based on this intersection of activity in the campaign, the size of the local homeless population, and the possibility for very significant impact numbers-wise and systems change-wise. We have a very strong, experienced team, on average 20 years experience in the field. We are moving toward a sustainability plan that reduces our dependence on foundation income by 2016. We are here in an effort to get feedback and support for our growth capital needs, which are $5 million over the next 5 years to grow the infrastructure to sustain this work, and also to create a real estate acquisition and development fund for those targeted communities. And this is the potential for impact as we see it. Beginning in New York, we've now moved to 7 other communities with our direct development work. In terms of our VA communities, we've targeted the cities with the highest rates of veteran homelessness, and we are working in most of them now. And the 85 communities that are part of the 100,000 Homes campaign represent many of the communities with the highest rates of homelessness. Our target is to reach those 55 communities that represent over 65% of homelessness in the country, and then to welcome any community of any size to participate in this national movement. The movement is both a platform for the distribution of innovation. It's a learning network. We're able to solve many of the problems that have hindered rapid housing placement by having monthly innovation calls to help people problem solve from city to city and move their way around the historic blockages that keep people on the street. And it's also an effort to really, and we're seeing in very significant ways, show that we can cross these systems and break through these siloed problems by focusing on high vulnerability individuals in targeted communities over a sustained period of time, using the shared expertise and learning of a whole country's worth of potential change agents looking to reduce and end homelessness. We hope to reach our goal of 100,000 homes for 100,000 vulnerable Americans by July 13th, 2013, and very pleased to be with you today to educate you about our work, our mission, our hope, and to entertain your questions on our plan. Thank you.